My name is Andrew Craner. This is my assignment for the presentation we're supposed to do. We're supposed to pick two different careers. And the first career I picked is just a care advocate for, like, if you were to work at a hospital as a counselor, and you would go help people that are struggling with their recovery mentally and just those issues, and then helping with their family. So whether it can vary from uh, drug addictions and then to different illnesses you go through and the trauma that comes from it, and then other things such as like accidents you may happen. Someone got shot or a car accident, or they witnessed somebody die and they were a part of it, something along those lines. And a care advocate with American Family License, or any kind of license of that fact would go in there and they'd counsel them through it. And they start out about 35,000, and then they range up to about 65,000. So they can make pretty decent money. You do have to have a master's degree, 4 years, and then they prefer you to have 2 or more years prior experience. I found this website that talks about it, and it's a United Health Group, and it helps people understand what they're trying to do, what they're trying to accomplish. Um, you get obviously working with in the healthcare system, you would get healthcare benefits, 401k retirement plan, um, and you get dental and eye um, insurance. Yeah, insurance. Your work environment, obviously, you'd be working in like medical facilities. You'd be working traditional hours, but you could be working longer hours, and then obviously depending what shift you would work, but you generally work just like an 8 to 10 hour shift. And you're working in hospitals and other clinical places such as that. So I really enjoyed learning about that. And then the other one I chose to do, which I think would be a pretty interesting job, is family intervention specialist. Um, the place I found it was the organization. It's Youth Villages. They're based out of Cookeville, Tennessee, but their main headquarters is in Memphis, Tennessee. They have a phone number you can get a hold of to talk to them about it, about their career. There's a website. Um, so it's pretty interesting. So it's family intervention specialist. So it's just someone who tries to intervene with the family and trying to help them out. And it's cool because you would work inside the people's homes. Don't have your own office. They obviously are stationed out at Cookeville, Tennessee, but you would actually go work in the people's homes. You would spend time getting to know the family. You would build a relationship with them to a certain extent, and then you would try and uh, analyze the issues they were going through and like try to figure out what was wrong, whether it be the child, the parents. Usually, it talked about mostly dealt with like the children in the family. You would pick up a workload of 4 to 6 families at a time, and you just work with them until I guess you felt satisfied or the family felt satisfied with your abilities, and that you felt those things. You would have to have your own car and your own cell phone, but they talk about that they would reimburse you for the miles you drive, and they try to keep you within an 80 mile radius. So you stay within that radius of driving. You won't have to drive too far, but they do reimburse you for the mileage that you spent just for driving for your job. Um, and you would spend 3 to 4 times a week with each family. So it could be you can spend pretty long hours. So the workload can be pretty hefty, but um, I think it'd be worth it. And I think it'd be pretty rewarding seeing what you would go through. Um, and just talked about that a lot of people they were able to build really good, healthy relationships with these people, and they saw a lot of good things out of it. I was reading some of the success stories. You would start out at around 36,000, and then they only make up to about 45,000. So they don't make a ton, but you would still need American Family degree and your master's degree, um, and then they would prefer if you had more flexible schedules, if you were excellent with verbal, written, and oral skills, and it really helps to have understanding or education in drug and alcohol. Um, yeah, you don't work outside. You work outside of an office, and so it'd be basically in your time, on the family's times. You would That's what the hours would be. It wouldn't be just like 8 in the morning till 5 at night. If the family could only meet with you from like 7 o'clock to 9 o'clock at night, that's when you would have to. So as far as like having a family, I guess that would be a typical stressor if your wife worked different shifts, or and then the only time it would be in the evening to see them. If you had to spend time with these people, your clients you meet with, if they go and meet with you those times, the stressor I think would, depending on your family time, you may not be able to see them as much. And it could be a good thing if your wife was to stay at home, or your husband, or whatever the case may be. That if you only worked in the evenings, during the day you could spend more time with your family. But I really enjoyed looking at these two jobs, and I felt that they were really informative, and they got really good websites. So that's my profile. Thanks for listening. Bye.